increased. And it's such a sensitive indicator of autoimmune tendencies. They were taking some supplement, NA titer may be up. They have heavy workup. It may other people develop lupus after too much sun and exposure to ultraviolet, or after taking some medication.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, and I'm joined again today by the amazing Dr. Alex Grunberg. If you've not met Dr. Alex before, he's done a few amazing podcasts with me. I'll give you the short version of his amazing resume because it is a big, long, extensive one. But Dr. Grunberg trained in Russia, started his medicine degree back when he was 16. So he's been doing it for a long time. Not to say that you're old, Dr. Grunberg, but that 16 is a very young age in anyone to start a medicine degree. He has a special interest in biohacking, longevity, peptide therapy. He was training under Dr. Kavashin, who is the grandfather and the founder of peptide therapy. He's got a huge interest in virology. He's worked for government agencies. He sits on the research board of big research grants. I know that he's on one here at the University of Adelaide in Australia, as well in the US. And I know he consults and works with the US Health Department as well for all things virology and drugs coming to market. And he's got a special interest in AI and how that connects into better enhancing our understanding of health. The resume is long and huge. And if you want to hear more about it, I'll put the link to Dr. Grunberg's practice below. He is also a psychiatrist, so he's got an amazing background and understanding of how the human mindset and mental health plays an impact on disease. So Dr. Grunberg, thank you again for your time and your knowledge and your expertise and wisdom. It's always great to have you on the podcast because I always learn so much from you.
It's very interesting. ANA is very dynamic parameter, and I see even when people have normal ESR and CRP, sometimes titers of ANA increased. And it's such a sensitive indicator of autoimmune tendencies. Because I see it, if people have chance, and I check their blood even weekly, I see significant variations in ANA. They just got little virus, they think they just were under weather for a couple of days. ANA titers may jump up 2-3 times. And they were taking some supplement, ANA titer may be up. They have heavy workup, it may be up. So, and it gives us an idea, and with this particular person, what particular triggers autoimmunity, because I've seen people having first episode of lupus after running 100 kilometers run, absolutely healthy people. Or other people develop lupus after too much sun and exposure to ultraviolet, or after taking some medication. So it's very good. I just give simple example to get better understanding of your own body, see why your ANA gets up, what raises your own ANA. Maybe you should avoid this, maybe. Instead of doing expensive gene testing, you can see just phenotypical expression, why your system reacts in this autoimmune way, because sometimes gene tests give very inconclusive results, and most of them are prohibited from giving any clinical implications of what they see. That's also very important. That's why frequently in the results, after doing very expensive tests, you find that you need to take more glutathione, folic acid, or vitamin D. And obviously, less expensive clinical tests, commonly available clinical tests, could help you to do this, and this amount of money you could use for something more productive, like high quality supplement or banking your stem cells.
Yeah, and I want to make that point. And yes, thanks for going back to ANA, because I think it's a very underrated test. I mean, I see a lot of people with MS and Parkinson's, and I would say 60% of my MS patients have raised ANA. So I go, okay, they've got an autoimmune tendency, and then others don't. And it gives me very specific information about how to treat a patient, of whether they're autoimmune versus maybe more inflammatory and those sort of things. It's an underrated test. Most doctors say with it slightly elevated, it doesn't mean anything. You and I would go, yes, it does. The other thing I want to come back to what you mentioned is lots of people, and again with people that are amazing, like Gary Brecker, who's been all over the podcast lately, are talking about having gene tests and then taking whether to take, if you've got the MTHFR gene, and whether to take activated folate or not. My point to that is most people have one of the MTHFR genes, the C677T. I think it's 67% of the population will have heterozygous expression of that, meaning one gene fold. The thing about gene testing is that just because you've got the genes doesn't mean that the gene's active. So that's where what you're saying, just so everybody understands, is that functional pathology testing will tell you whether a gene is up or down regulated and what's happening via that biochemical pathway. So if you're interested in working with a professional like Dr. Grinberg, and like he mentioned earlier, he's been interested in this since he was 5 years old. So if you want someone that's got longevity in this field, this is the man. And I know lots of big companies are now reaching out to him and for his knowledge. So before you get super uber busy and you cannot get hold of him, I'll put his details in below. I also know he's very happy to answer any questions in the comments. So if you have any specific questions about biohacking and interventions, please pop them in below. I can always reach out to Dr. Grinberg to answer those specifically. Dr. Grinberg, as always, thank you for your knowledge, expertise, and passion in this area. Again, someone that's been interested in it since 5 years old is pretty spectacular. So I know you definitely know what you're talking about in this area. So again, anyone that wants to work with Dr. Grinberg, I'll put his details below. If you want to know more about what we do, head over to www.kidneycoach.com. You'll also find us on Facebook and Instagram. And we hope to see you there. And thanks for being part of our community. We will see you next time.
Thank you. Thank you, everyone who is watching, and wish you successful and beneficial biohacking.
Bye.